Listeners, I am here with Dr. Glenn Pierce, one of my favorites, who's going to give us kind of an overview of what WFH Congress is going to look like this year in Madrid. Glenn, welcome back to the podcast as always, my friend.
Good to be here, Amy. Thank you very much for having me and for giving me an opportunity to talk about the WFH, the World Federation of Hemophilia Congress that's going to be in Madrid in late April. It's a Congress that we run in full-blown form every 2 years and is really a chance for the world community to get together. Not only the patients, patient advocates, but all of the range of healthcare providers, regulators, and payers, as well as industry, come together to under one tent to have a chance to exchange a lot of information. So really very educational, not only from the sessions, but from the hallways. Running into people, having a chance to understand culturally where they're coming from, what life is like in this country or that country if you've got a bleeding disorder. So I went to my first one back in 1990 when it was in Washington, D.C., and really I'll never forget the kinds of people that I met and the stories that they had to tell, many of which were heartbreaking. Because for us living in the 15% of the world, having access to a variety of state-of-the-art therapies, that is not the case for the 85%. And so a significant part of the conference really does focus on all of the therapies, including the ones that are more limited in the rest of the world. And that's important. It's important for awareness. It's important for us to understand how we can continue to advocate for health equity. That's really what.
Glenn, from your vantage point, what are some of the highlights that Congress is going to have here in Madrid?
Well, it's just a few days long, but it is contains 90 hours of educational sessions. Some are simultaneous. We've got 75 sessions that are spread across 8 different tracks, lots of workshops, 7 plenary sessions where everybody comes together, and then 52 educational sessions, 10 free paper sessions, and 3 late-breaking abstract new technology sessions to talk about some of the latest results and what's next. We've got about probably over 250 people from 53 countries that are coming in to talk and exchange information. We have basically 2 main tracks, a medical track that is medical and scientific in nature, talking about treatments, healthcare, and the management of bleeding disorders. And then we've got a people with bleeding disorders track that talk about more comprehensively living with bleeding disorders, outcomes, and how to succeed in gaining access to therapies. We then also have 6 professional tracks for our professional members, in addition to the medical tracks. So lab track, nurses track, musculoskeletal track, psychosocial, women and girls with bleeding disorders track, and a dental track. So a little something for everyone at this conference. We also, the day before the conference starts on Sunday, we have workshops. And the workshops really focus on our humanitarian aid program, our blood safety availability, coagulation products, safety availability and supply activities, and then our data and demographics, our research programs, and how they go about collecting data, and of course, what the data show.
Glenn, something that jumped out to me here on the agenda is that plenary on safety.
Yeah.
And I just wondered, what was the genesis of that? What is that session going to be about? It says aims to empower the community to take proactive measures to ensure that we learn from past experiences and advocate for safety in bleeding disorder care, which I know is important, but it just seems like it hasn't been like a topic,
Yeah. Well,
at Congress or meetings
well,
lately.
that's exactly why we decided to do it as a plenary. Now, on Sunday, our coagulation products safety, supply, and availability committee will have several hours on some of the details of safety,
Mm,
as we always do. But it also talks about availability and supply, and affordability, which is very important
mm,
too. But when you think about where we are today and the range of products that are available, safety no longer fits into one little box. So if you go back 25, 30 years, we had plasma derived products. Actually, up to 30 years ago, that's all we had was plasma derived concentrates. And uh, safety could be well categorized: concern about inhibitors, concern about viruses. And so now we fast forward 30 years and we have a variety of different therapies, as we all know. And the key thing about drugs is that it doesn't matter who we are, what illnesses we may have. For every drug, there is a benefit and there is a risk. And so there are consequences for all of us when we take drugs, and we need to understand what those consequences are. This feeds into informed decision making,
mm,
shared decision making tools to really
mm,
understand. And as we look at our landscape today, it's way beyond plasma derived factor 8 and factor 9. It's way
mm,
beyond recombinant factors. We're dealing with monoclonal antibodies in a variety of forms that either
mm,
can mimic factor 8 or rebalance the coagulation system. We're looking at RNA molecules that can rebalance the
mm.
coagulation system. And then we're looking at gene therapy, of completely different set of benefits and risks associated with this kind of technology. And so putting it all under one roof and having a plenary on safety helps us at 100,000 foot level or 100,000 meter level to really look at safety as a whole within the bleeding disorders community. And as I mentioned, feeding right into informed and shared decision making. Patients need to take responsibility for not only looking for the efficacy, which is very important, but for looking at the safety. So what's the risk
Mm,
associated with the benefit? And that's why we've
mm,
turned it into a plenary to really draw attention
mm.
to the need for all of us to take even more responsibility because it's gotten more complicated.
Glenn, tell me about the medical track. What are you clinical nerds going to be nerding out about at Congress? That's our favorite topic here on BloodStream is what the clinicians are nerding out on.
Yeah. Well, I alluded to it. The benefit risk is an important one. And
Yeah.
so you can break that down and look at the various benefits of many of the treatments that are available or in clinical
Mm,
trials. And then you can look
yeah.
at the risks that are associated. So this provides us with an opportunity in the medical track to look at things in much more detail and with the latest information as well, because even though clinical trials for some may be over, post-marketing studies are still ongoing. Data are still being collected for these new technologies. And that's important for us to stay abreast of what comes out from real world data, as well as what comes out from additional clinical studies, even after products are approved. So there'll be a lot of that. There also will be a focus on new technologies. And so what's coming? For instance, for gene therapy, it looks like we may have some long-term curative-like effects for factor 9. We'll see, but so far the data are looking good. Uh, but for factor 8, it's not so clear that we have either
Mm,
long term benefit or that it's necessarily curative for many patients. And so, understanding what the limitations are is important as we make our way toward getting to curative therapies. The goal here
mm,
is to cure bleeding disorders. It's not
Yeah.
more treatments necessarily, although we need more
Yeah.
treatments along the way, but it's to cure bleeding disorders. How are we going to get there? How are we going to get there for factor 8, factor 9, for von Willebrand disease, and then for the more rare coagulation factor deficiencies? So there'll be some discussion on that as well at the World Congress.
What's the community patient track like at Congress? How is it differ from like BDC or something here in the States?
Well, BDC is terrific and, of course, offers a tremendous amount of programming, but the programming is really focused on the 15%, 15% of the world that has access to all of the products. The
Yeah.
bleeding disorders, the people with bleeding disorders track at the world is much broader. So it not only focuses on the 15%, but it focuses on the other 85% as well. And so if you have limited resources, if you have limited availability or access to products, what can you do? How can you maximize the use of those products most efficiently? How can you minimize the bleeding that occurs? How can you best control the bleeding if you don't have the most optimal therapies available? And so there's a lot of thought and effort does go into that from the medical and healthcare provider community, and that's important to exchange that kind of information. How do you treat complex kinds of bleeding episodes that we don't see and we haven't seen here for 30 years? Things like
Mm,
pseudotumors that form
mm,
large collections of blood that don't go away and can wind up destroying a limb and potentially killing a person, or other kinds of bleeding that really leaves a tremendous amount of sequelae because the bleeding is more uncontrolled. Key thing with bleeding is to prevent it, and if you can't prevent it, it's to stop it right away.
yeah.
Well, that
Yeah.
doesn't really happen in most of the world. We don't
Yeah.
prevent it, and patients are often way too far away from getting any sort of treatment to stop it right away. So by the time they can
Mm.
get access to treatment, assuming some is available, that is turned into a full-blown major bleed that takes, as we may remember from years past, weeks to resolve. I remember that from my childhood. Weeks, weeks and weeks
Yeah.
for
Yeah.
all of that blood to be eliminated. So that is what happens, and there are best practices for managing patients, and those are important to exchange because they literally can save lives.
Glenn, thank you for being here as always. Just wanted to give you one last shout out. Is there anything else that we should mention when it comes to Congress? I'm very excited about it. By the way, it's going to be in Madrid. BloodStream listeners, Patrick and I are going, so we'll do our on the ground, nerdy reporting as we're there. We can't wait. But anything else before we close?
Well, I've been to Madrid a couple of times on business and had opportunities to get to some of the museums. It's impressive. There's a lot of Spanish artists that are very well known, besides Picasso, of course, and their museums are filled with those. But I think from the perspective of the Congress itself, the most important thing is to just take it all in, and don't be afraid to talk to a stranger, and find out who they are, what they're doing, how they cope, how they manage, because it's a fascinating cut across humanity, and whether you're fortunate enough to have access to the latest and greatest, or you only have access to something that's been around for 30 or 40 years, people cope. And they all cope in their own individual way. And understanding that gives you a perspective that is really important as we think about ourselves as citizens in this global community.
Dr. Glenn Pierce, thank you for joining us as always. Please tell your wife I said hi, and I'll see you in Madrid.
All right, Amy, great to talk to you again, as usual.